Implications for professional practice, system design, and policy making. A short segment for the Information World's Healthcare Professionals presentation for LIS 510. Some implications for professional practice. Don't let it go. It's important to follow a procedure all the way through as far as one is able. As we've learned throughout the presentation, every time something wasn't followed through, a communication barrier or failure occurred. Speak up and often. By not speaking up, communication barriers and information failures occur. Break down the barriers of structural secrecy by building in transparency. The more transparent each field is, we'll be able to see what happens in that field, and thus the barriers of structural secrecy will be broken down and communication will be improved. Learn what others perceive as cognitive authority regarding a field and expose misperceptions. For example, when patients perceive nurses know about their insurance particulars, communication barriers occur. So it's really important to know how your field is perceived in order to expose misperceptions and build stronger relationships between fields. So for system design, test it, talk about it, train for it. When a system isn't working, it isn't benefiting anyone. Why build a system if it isn't useful? A lot of times, information professionals say users aren't getting the most out of the system. Well, train the users to use the system so they can get the most out of it. This could be in the form of tutorials or visuals in the waiting room for patients. For healthcare staff, this could look like short training sessions with in-house IT staff or interactive tutorials. Create and utilize interdisciplinary groups to build better functioning systems. By having interdisciplinary project groups, structural secrecy will be dissolved and the transparency that results will benefit not only the creators but the end users. Overall, this will foster a stronger operating environment due to higher job satisfaction and higher quality patient care. Test the system. The bottom line is we can build policy to ensure that there's more testing, talking, and training. In regard to policy making, get your research on. With more research about information failures and communication breakdowns, we'll be able to further understand how to build working policy to minimize adverse events in healthcare. A lot of work has been done, and there are many checks and balances in place to ensure interdisciplinary workflows continue. However, with additional input, more efficient workflows can be implemented. Interpersonal communication, transparency, stress management, and belief systems are all areas that could be a focus for ways to reduce information failures and communication breakdown.